This is Dr. Paul Aschinberg, and today is May 16th. So more news this week regarding coronavirus. So as we've been doing over the last few videos, we can review the daily cases and how they're trending. And this week, the news is good. It looks like we are finally seeing this downward trend that we've been hoping for. After several weeks of kind of leveling off or going up slowly, it does look like we're finally getting that turn and a decrease in the cases in the United States. And this is the other chart we've been looking at, which is the deaths per day in the United States. And we're seeing the same kind of thing, that after leveling off over this last week, we're starting to get that decrease. So some very good news in terms of the number of cases and deaths in the United States. Several of you have asked me to review the local numbers again here in Illinois. And I have the charts for the state as well. And I think there are some kind of take-home messages for other states that we can learn by looking at Illinois also. So this is the graph of cases by day in Illinois. And this line kind of averages out the peaks and valleys that you may see here. And so we were starting to kind of go up here, and we had the lockdown, and then things seemed to level off. And then kind of in middle April, things kind of went up quite a bit. And now in May, they've leveled off again. And so this was something that wasn't too expected, to see this big increase in cases while the shutdown was going on. But taking a look at it, it does look like this has more to do with the big increase in testing that was done at that time, and that more and more people who weren't that sick were being picked up. Whereas back here, in order to even get tested, you needed to be quite ill. And so many people who had mild symptoms were not picked up, and here they were. And one of the reasons we can say that with some confidence is that the death cases, these are the number of people dying per day in Illinois, did not see that kind of increase. We see that we had that rapid increase, and then in April it kind of leveled off. It went up a little bit at a time, but it didn't have that huge increase we saw in the cases. And so if there really was an increase in cases, we would have expected to see an increase in deaths as well, which we did not see. The other good news is, even with the increased testing, now things have leveled off in May. And this now means that we do meet the criteria to move into the next phase of opening by the end of the month. Phase 3 reopening is what Illinois calls it. And that means that pretty much all stores other than restaurants and bars will be able to reopen and have shoppers come into the store. Manufacturing, construction jobs will be able to pick up as well. And even though we will still have to wear masks and do social distancing and not be in crowds in the shops, it's certainly a step in the right direction. Even barbershops and hair salons will be able to open up. Now, something else that the data shows us about these graphs are that in states with large cities like Chicago and Illinois, this graph really is more representative of what's going on in Chicago and its county, Cook County, than the rest of the state. Even though Cook County and Chicago represent less than half of the population of Illinois, they have more than 65% of the cases and deaths in the state. Most of the rest of the state has been level or showed a decline. This is actually, I know it's a little bit of a busy graph, but this is actually the graph of the number of cases in a local hospital in our area. And these are the intensive care beds being used for COVID patients in the hospital. And you can see how over the last 2 months, it's just been down and down and down. And this is the number of regular beds being used for COVID in this local hospital. And for a while, it was kind of level. And then again, over the last month, we see a drop. And so the studies show that in many states with big cities, whether it's Michigan with Detroit, whether it's Massachusetts with Boston, whether it's New York City, certainly in New York State, that the cases in the cities tend to be much higher than in the rest of the states. And that's important moving forward, because as we reopen, we have to know where the high risk areas are that we have to look out for, so that we don't see big spikes that will make us have to close up again. And even though cities are a risk factor, there's actually one area that's even a much higher risk factor when you look at the data. And this area is still open for business. They have not had to shut down, and yet they are a very, very big risk that drive the number of deaths. And what I'm talking about here, of course, are nursing homes. From looking at the data, we see that nursing homes are a huge risk factor for coronavirus. Even though less than 1% of the population work or live in nursing homes, they account for 35% of the coronavirus deaths in the country. And in fact, there's some states like Maryland where nursing homes account for half of the deaths in those states. And yet, there's really no major plan or strategy for how to address this, even though a quick look at the data, it just jumps out at you. And as we reopen, and there will be more cases and more deaths, if there are more nursing homes affected, then the number of cases will spike up very quickly. And so if we want to reopen, we need to address the nursing home crisis. And this is yet another area where I think the media and the politicians have failed us, because when you listen to the news or listen to the politicians, everyone either wants to open, or close. And we have to see how best to open and what the hot spots are to address the risky areas so that as we reopen, we don't see spikes. And certainly, nursing homes are doing their best to try and limit the spread. They're not allowing visitors. They're trying to be as careful as possible. But there's just no way that we can decrease the risk of nursing homes unless they get a lot of help, and unless we try to find places to redirect some of the residents so that we can space them out. In major cities, there's nursing homes with hundreds of patients, 3 to 4 people in a room. And that's just a recipe for disaster with coronavirus. So I'm not a nursing home expert, but things like insurances paying families to bring back their loved ones into the home and still paying them what they were paying the nursing home to try and thin out the numbers, or when there was a risk that hospitals may be overwhelmed, the government was building temporary hospitals and talking about taking hotels and using hospital rooms, trying to maybe do that for the nursing homes so that people can be placed in other places so nursing homes aren't so densely packed where they're at such high risk. Things like this need to be considered in order to decrease the risk. So that's the news for this week. I did want to try and get to some of your questions. Many of you had questions about treatments and vaccines for coronavirus. And certainly, as much as we talk about opening up and trying to address the high-risk areas like cities and nursing homes, the end game, the way we fully get back to normal, of course, the quickest is if we can find a treatment or a vaccine. So as far as treatments go, in order for life to really get back to normal, we would have to have a treatment that's quick and that can cure about 80 to 90% of patients. And we're not there, of course, but there are some positives. There's a drug called remdesivir, which studies have shown that can help cure about 30% of patients. So that's a decent number, and it's being studied more to see if that's true. And the good news, once you find a drug that can help at least some patients, is that it can then be adjusted and studied and made better to try and improve that 30% number, whereas when you're starting from scratch, that's much harder. There's also something you may have heard about called convalescent plasma that can help certain patients. This is when maybe younger, healthier people catch coronavirus and their immune system fights it off. The immune system kills the coronavirus with what are called antibodies that are kind of like smart missiles that the body produces that can find the coronavirus and destroy it. And those antibodies stay in our bodies for several months and sometimes years after you fight off the infection. So if people who've successfully fought it off donate their blood, we can actually take those antibodies out of their blood and give them through an IV to patients who are very sick. And that's holding some promise too. And beyond that, if we can find those antibodies, we already have the technology to make the antibodies in a lab. And so if we can isolate those antibodies from the people who donate their blood, we can make more and more of them and use that as a medicine to try and help treat patients. So that's one of the promising therapeutics as well. In terms of the vaccine, there's actually exciting news there too. There are several vaccines being developed. In fact, one vaccine from England has already shown some positive tests. They actually took 9 monkeys and sprayed a bunch of coronavirus in their nose. And of those 9 monkeys, all of them got sick with pneumonia and did not do very well. And then they got 6 monkeys and they gave them the vaccine that's being developed in Oxford in England. And after a few weeks, they sprayed the coronavirus in their noses, and none of those six monkeys got sick with pneumonia. And so that's very encouraging. And in fact, it was so encouraging that human studies have started, and more than 1,000 people now have gotten that vaccine to make sure that it's safe in humans and to see what their response is. And there's some hope that this and a few of the other vaccines showing promise may be available by the end of the year. So that would be great news. Even if no treatment is found and no vaccine is found, history has shown us that pandemics do eventually burn out. Even the Black Death, the Black Plague that's hit Europe and the world 700 years ago, burned out after a few years. It killed half of Europe. But even then, when there were no antibiotics, no vaccines, when people thought that the Black Death was because Mars and Saturn did not align correctly in the sky and they had no idea about germs, it still burned out. And the last great pandemic, the Spanish flu of 1918, also burned out after a couple of years, and life went back to normal, even though there was never a vaccine or any treatment. And so even in the worst case scenario, if we don't find anything, it may take a year or two, but this pandemic also will eventually burn out. And so life will return to normal. A couple of other questions that have came up, hopefully a little bit quicker questions. Someone was asking about, they heard that smoking can potentially help with coronavirus, and is that true? And even though there were some early studies that may have suggested that, that did not pan out. Smoking does not protect you from coronavirus. Other people were asking about takeout food, and is that safe? And yes, takeout food is safe. It might be a good idea to wipe down the packaging when you get takeout food and bring it home to wipe everything down, but it is certainly safe to eat takeout food. A couple of people were also worried that after staying home for a few months, that may actually lower our immunity. And once we go back out, we may be more prone to infections because our immune systems are low. And really, I don't think there's much risk of that, especially in older kids who've been in school for a while. Adults, we've had years of exposures to build up our immunity. And so a few months at home sheltering in place should not be much of a concern for when we start opening up and go out again. And finally, I've had several people email me from around the state and even from out of state now that people are heading back to work, kind of sharing some of their personal stories or what kind of job they're going to go back to, asking my advice to see if it's safe for them to go back to work. And certainly I'm very honored that people who don't even know me personally are interested in my input and my advice from these videos. But unfortunately, I just don't know that I will be able to give those questions the proper time they need to answer. It does depend somewhat on everyone's medical history. Are they generally healthy? What medications you have? And so I do apologize that I don't know that I will be able to respond to all of those emails personally. What I can say is for people who are young or middle-aged, I'm talking people below 50, certainly below 40, you are at very low risk of dying from coronavirus if you catch coronavirus. And the bigger risk of everyone going back out is spreading it around, and the big spread and getting it to vulnerable people or vulnerable populations like the people in the nursing homes. And so I do think for the most part that if you do not have medical issues and you are in your 20s or 30s or even 40s, it is relatively safe to go back to work, taking the standard precautions of masking and avoiding crowds and not go into a crowded office where there's a whole bunch of people all in each other's face to try and spread out. I think under those circumstances, people should be quite confident of going back to work as long as we're all smart about it. So if I did miss any questions that you've had, please feel free to send them back to me, and I will try to get them to answer them in the next videos. And as more information comes in, I will try to keep everyone posted. Thanks again, and be well and stay safe.